Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the Veterans Health Administration Office of Mental Health and Suicide Prevention Education and Training Office. My name is True Lester Pauling. I am the Senior Outreach Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation is not available after this webinar, but a handout will be made available with all the resources Mrs. Mells will speak about today. This is a live recording. I would like to thank Ms. Lillie Mells for this collaboration. We are grateful for your time today. But before I get started, I would like to acknowledge Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnerships. Mr. Washington serves as the Director for the VA Center for Faith-Based and Neighborhood Partnerships. He is a retired combat Marine with 20 years of active duty service. He is a licensed minister actively serving in his faith. He received his Master's of Divinity in Pastoral Studies from Moody Theological Seminary, Master's in Business Management, and a Bachelor of Science degree in Education. Additionally, he is a graduate of VA's Class of 2017 Virtual Aspiring Leaders Program. Unfortunately, Mr. Washington will not be able to join us today, and he sends his regrets. At this time, I would like to introduce our speaker for today, Ms. Lillie Mells, who will be providing today's presentation. Please read a summary of her bio to the left of the screen. Mrs. Mells is a licensed clinical social worker with over 20 years of experience. She has worked in various capacities to include child abuse, domestic violence, and substance abuse. Lillie is an Air Force veteran and has served as Director of Psychological Health for the Virginia Air National Guard. She has been with the Department of Veteran Affairs since 2013, working in suicide prevention. Currently, she is the Education and Training Program Coordinator at the Office of Mental Health and Suicide Prevention at VA Affairs Central Office. At this time, I give you Ms. Lillie Mells for today's presentation. Lillie?
Good afternoon, everybody, and thank you, Ms. Pauling. It's always a pleasure to be here and provide this training for the Center for Faith-Based. I'm excited, and I see we got quite a few folks online, so I'm going to go ahead and get started. I am going to turn off my camera because sometimes we get bandwidth issues, and we want to make sure that this presentation goes smoothly. Okay, so today I'm going to do our VA SAVE training, and this is basically our one-on-one suicide prevention training. It's our gateway training at the Department of Veterans Affairs. So before we begin, I'd just like to say that suicide is an intense topic for some people. And so if you need to step out or take a break, please do so. If you need immediate resources, you can call the National Suicide Prevention Lifeline at 988. Or the Veterans Crisis Line, which is also 988. The only difference is that you would press number 1 if you're a veteran or service member. And I want to get started by doing a little bit of a roll call. And so I want to see if we have any service members on the line. So can you look at your chat box, your Q&A box, and I want to know if we have any Army service members on the line. Type in the box if you're Army. Okay, great. Anybody from Navy? Any Marines? Great. What about our brothers and sisters in the blue, or my brothers and sisters in the blue, Air Force? What about Air National Guard? I see we have one Air National Guard. Anybody in the reserves? What about our Coast Guard? Okay. And our U.S. Space Force. That's our newest service. Okay, great. Well, the reason I want to acknowledge folks today is because we just passed Veterans Day weekend on the 11th, which was Saturday. And I know as far as service members, each branch brings a different mission to the fight. And I just wanted to acknowledge all the branches for being on the line today. I too served and I retired in the Air Force and I also deployed, and I deployed alongside each branch of the armed forces, and I have a different respect for each one. So I just wanted to acknowledge that. Okay, this is what we're going to cover today. Facts about veteran suicide, common myths and realities about suicide, and our VA SAVE steps. And that's going to teach you how to react and with confidence when you encounter someone who's at risk for suicide. And then at the very end, I'm going to go over some resources. So by participating in this training, you will have a general understanding of the scope of veteran suicide within the U.S., how to identify someone who may be at risk for suicide, and know what to do when you do identify someone at risk for suicide. Now, I want you guys to think about this question. What are your biggest questions around suicide and talking to people in crisis? What are your biggest questions around suicide and talking to people in crisis? So I want you to think about that question, think about the questions that you have, and then hopefully by the time I get through the end of this training, those questions would have been answered. So let's go over some facts about veteran suicide. So suicide is a national issue. It's actually a public health issue as far as the Department of Veterans Affairs is concerned. The numbers continue to rise in the general population and continue to rise as far as service members. And so for every death by suicide, there's at least 135 individuals who are impacted. And I would venture to say that they may even be more. When you think about that individual, if they are employed, that means that they have people that they work with. It could be people next door to them in their working environment. It could be people they communicate with over the phone, over the computer. If they belong to any organizations in the community, if they belong to civic organizations, churches, any teams, some people are involved in team sports, family members. Even if you go to the local grocery store, there's at least 135 individuals that are impacted. And like I said, I venture to say there are probably even more. Now, suicide is a complex issue. There's no single cause. What we have found is that it's often the result of a complex interaction of risk and protective factors at the individual, community, and societal level. And so risk factors, these are those things that are challenges for us. These are things that are obstacles, things that get in the way and impede someone's ability to function. And so when you have increased risk factors, it's the likelihood of having suicidal behaviors. And so what we want to do is increase the protective factors. Now, protective factors are those tools, those skills, those things that you can use when you're faced with challenges. And so protective factors, they can help offset the risk factors. And so to prevent suicide, we like to maximize the protective factors and minimize the risk factors at all levels throughout communities nationwide. So now we're going to discuss a little bit of the risk factors and protective factors. Now understand this, that risk factors and protective factors, they can be a whole host of things. This is not an exhaustive list that we have here. These are just some of the ones that we have seen more frequent than others. But believe me, there are many more things that could be on this list. So let's start with the risk factors. Now remember, I said the risk factors are those challenges, those obstacles, those things that impedes people's ability to function. So first on the list, we have prior suicide attempt. So someone who has had a prior suicide attempt, it doesn't necessarily mean that they will go on to have another suicide attempt, but it does put them at a greater risk than someone who has not engaged in that type of behavior. Okay? Mental health issues. So when we talk about mental health issues, we're talking about those issues that have gone untreated. Depression, anxiety, PTSD, all these type of issues that go untreated. And when you have untreated mental health issues, it definitely puts you at a risk for suicide or suicidal behaviors. Now, I'm going to ask one quick question for our audience. Name one or two things, one or two reasons why people don't seek mental health. Just put it in the chat box why we think people don't seek mental health care. Anyone just go ahead and drop. Okay, I see someone said embarrassed. Correct. Pride, stigma, absolutely. These are all good reasons why people don't seek mental health care. Other issues are they don't have proper insurance, they can't afford it. Some people are in denial about what's going on with them. They haven't recognized that they need issues. Some people have had a bad experience and they won't go back to seek care. So there are a number of reasons. Also, there's some cultural reasons. Certain cultures don't believe in mental illness, and so therefore people don't seek help. So there's numerous reasons why people don't seek help. And if you're talking about our military people, there's always that fear of, loss of job, loss of plush assignments, those kinds of things, loss of security clearance. So there's a good number of reasons why people don't seek mental health care. Next, substance abuse. So when we talk about substance abuse, these are things that are going to alter your mood and your judgment. So anytime you're taking illegal substances or controlled substances in a fashion that's not prescribed, it's going to lead to risk factors for suicide. Any substance that's going to alter your mood and judgment is definitely going to put you at a risk for suicide. Next, access to lethal means. So when you have access to lethal means, this could be a number of things, access to lethal means. It could be medications, it could be weapons. In this particular instance, we're talking more so about weapons. Firearms are the number one method that's being used as far as suicide. That's in the civilian sector as well as the uniform sector. Firearms, okay? And so if you have firearms, it definitely puts you at a greater risk for suicide. Next on the list is recent loss. So when we talk about loss, this could be a number of things. It could be loss of limb, loss of life, loss of job. It could be a number of things. But when people experience loss, it definitely puts them at a greater risk. Okay. Doesn't mean that everybody who experiences loss is going to be suicidal, but definitely if you have a combination of things that are going on, you have some mental health issues, some substance abuse issues in your background, it definitely is going to put you at a greater risk. Next, legal or financial issues. And legal issues, especially when you're facing jail time. When you think about the possibility of facing jail time, it definitely puts people at greater risk. Some people can't even think about possibly going to jail and losing their freedom. Okay. Also, financial challenges, going bankrupt, having to file for bankruptcy, losing your home, losing your job, those kinds of things. It definitely puts one at greater risk for suicide. Next, relationship issues. Now, relationship issues is very big on this list because when one experiences a dissolving relationship, many times it can feel like you're going through the grieving process. And as a matter of fact, you will go through some of the same steps as the grieving process. It might be denial in the beginning, it might be shame, it might be guilt, it might be anger, all of the same emotions that you go through when you're grieving. So relationships are huge. And there are often times where we see relationships that fail. You will see a lot of murder suicide as well. Not always, but we have seen it in most recent times. Next, unemployment. So when you're unemployed, it definitely puts you at a greater risk. You're not able to support yourself or your family. It definitely puts you at risk for suicide. And then last on that list is on the risk factors is homelessness. Homelessness is definitely a challenge and it will definitely be a risk factor for suicide. And, many times there's a combination of risk factors, not just one sole risk factor, but a combination of many. Now, when we move to the other side, we're going to look at the protective factors. Now, the protective factors, as I said earlier, these are those tools, those skills that you can use when you're facing challenges and overwhelming situations. First one we have on the list is access to mental health care. So it's kind of the opposite of what we said about not having mental health care. When you're able to have mental health care and you're able to see a therapist on a regular basis, some people may even need medication regimen. this will definitely put you in a better position than someone who's not getting help for those conditions. And there are some conditions that require ongoing medication treatment. So things like schizophrenia, bipolar disorder, these things have to be regulated by meds. And so if you're not engaged in mental health care, it will definitely put that individual at a greater risk. So having that continuity of care is definitely a protective factor. Next on the list, sense of connectiveness. So I know our military folks are well aware of this. When you're serving in the military and you're behind those gates, you're assigned to a unit, a team, you know what your mission is, there's a camaraderie in that unit, and so there's a sense of connectiveness. And when you're behind the gates in the military, it's like living in a city within a city. It's pretty much self-contained. You don't have to ever leave the base if you don't want to, because everything you have is there. It's a community there. And so for a lot of military members, when they transition out of the military, it becomes a little cloudy as to the connectiveness. It's not the same. You don't have that unit anymore. You don't have that camaraderie anymore. And so sometimes we lose that sense, but it can be a definitely a positive protective factor, that sense of connectedness. Now, next on the list, we have problem solving skills. And so I can just tell you, as a kid growing up in New York City, we didn't have a whole lot of problem solving skills. And maybe some of you folks on the line could tell me, what do you think was the number one problem solving skill we used? Anybody, you can type it in the chat box, the Q&A box. What kind of problem solving skill you think we used? Absolutely. Somebody got it right. They said fist. Yeah, we just fought. And I will tell you, that is not a good way to problem solve. And if we learn problem solving skills as children, we would do much better as adults. You see people who fought all the time as children, now they verbally fight. So instead of fighting with their fists, they fight with their mouths. But if we learn problem solving skills, we will do better when we're faced with crisis or challenges. Okay. Next, sense of spirituality. Now, this is very individualized. It's not a one size fit all. So you have to do what works for that individual. Some people will formally practice spirituality. Some people will go into a house of worship. Some people will meditate. Some people will read the Bible. It depends on what works for that individual. Okay, but it can be a positive protective factor. Next, mission or purpose. So when you leave the military, sometimes it's hard to figure out what your mission or purpose is next. And so for many, we stay connected. And that's why a lot of veterans you'll see working for veteran service organizations or the Department of Veterans Affairs, somewhere where we can continue that mission in helping. So when you have something purposeful that you're doing, it's definitely a protective factor. Next, physical health. One of the things I will tell you is there's no reason to walk around with physical ailments untreated and walk around in pain every single day. I will tell you, when I served in the military, I had no pain. It was get up and go. You were ready to go 7 a.m. in the morning, and then whatever you got home. And until I retired, that's when I realized I had pains that I didn't have before. And that was only because I just pushed through them and ignored them. And so what I'm saying is that we don't need to ignore our physical health. Make sure that we're getting those things treated, those ailments that have been lingering, those things that we have ignored. And when you get your physical health in order, it definitely puts you in a good position in terms of protective factor. So make sure that you're getting those things done. Next, employment. Employment is always a positive protective factor because you're able to support yourself and support your family. And so when you're able to do that, it definitely puts you in a good position. Now, if you have someone who's unemployed and they can't feed their children, they can't buy their children clothes, it's very difficult. It's very difficult to look your kids in the eye knowing that you can't provide a meal. So having a job is definitely a positive protective factor. Next, social and emotional well-being. So when you're socially and emotionally involved in things that are, fruitful for you, it definitely puts you in a better place. So being active in things and participating in things that are, advantageous for you and something that's going to help, it definitely puts you in a positive position. Okay. So that's our risk factors and protective factors. And again, we want to maximize the protective factors and minimize the risk factors. Okay, now I'm going to go over some of the key findings of the 2022 National Veteran Suicide Prevention Annual Report. I will tell you these numbers are a little bit old because the latest report will be coming out very soon. So if you look at the numbers here from veterans suicide deaths from 2001 to 2020, actually in 2018, the numbers were going up, 6,796. And then we see a dip in 2020 to 6,146. But I will tell you this, as someone who's working in this field, suicide prevention, trying to prevent veteran suicide, this is not a number that we can celebrate. 399 less deaths is not a number we can celebrate. We really have to put a huge dent in this number. So this is not one of the statistics that I enjoy presenting because I feel like we need to get those numbers drilled down way more. And then when we look at the veteran suicide rate by age and sex, and so if you look to the the right-hand side of the screen, you will see that the age is still 18 to 34. That's the highest age rate group that we're seeing in terms of suicide deaths, 18 to 34. The next group is 35 to 54. Okay. But look at our older adults, 75 and older, 32%. So that number is starting to rise. And then our lowest group is 55 to 74. And then if you look to the left of the screen, look at our veteran males and look at our veteran females. Both of those categories are higher than our non-veteran counterparts. Okay. Now, suicide death and methods from 2001 to 2020, and look at the differences. Now, remember earlier when I talked about lethal means? So when we talk about lethal means, we're talking about firearms, we're talking about poisoning, we're talking about suffocation, and then there's a smaller category that has other, and that could be a combination of things. It could be, ramming a vehicle into a fixed object. It could be leaping from a height, but they are smaller numbers. But if you look at firearms, just look at 2020 for non-veteran adults, firearms, over 50% are using firearms. Now move to the left, the right of the screen, and look at 2020 for veteran males or veteran adults, 71%. 71%. Veterans are using firearms at over 70%. Move further down, non-veteran men, 55%. Veteran men, 72%. And that's an increase, okay? But look at our veteran women. The non-veteran women are at 33%, but the veteran women are at 48%. That's an increase by 11%. Now, granted, I said some of these statistics are old, but this is from 2001 to 2020. And our 2021-22 statistics will be coming out soon. But the VA has determined that firearms is the number one method that veterans are using. And so we had to foot stomp our educating veterans on firearm safety, as well as our providers. And, we found that veterans, are reluctant to give up their firearms. An example would be if we found that someone had suicidal behavior or thoughts, immediately we would confiscate the weapon and they would never have that weapon returned again. But what we found with that is that it didn't work. Then people would not be honest about having a weapon. So we had to change that into, okay, how can we support you? Can we safely get that weapon stored until you get through this crisis? Can you store it with a trusted family member or friend who's over the age of 18? And we found that that seemed to work better than it's just going to be confiscated and you will never get that weapon again. Okay. And then when you look down the list and you look at the other methods that are being used, poisoning, suffocation, they don't even come close to firearms. They don't even come close. And so that's why we've had to beef up our education on firearm safety and storage. So what does lethal mean safety? So in the context of suicide prevention, safe storage of lethal means is any action that builds in time and space between a suicidal impulse and the ability to harm oneself. So again, any action that builds in time and space between a suicidal impulse and the ability to harm oneself. So that's what we're trying to do. We want to make sure that we build in time and space between the thought and the action. And effective lethal means safety education and counseling is collaborative, as I mentioned earlier. We've had to collaborate not only with the veteran, but their family members and the providers who are teaching them. Because one thing we learned at the VA is that many providers have never even touched a weapon themselves. And so educating providers on that and how important weapons are in the lives of many veterans. And so that seems to have worked a lot better. So it respects the important role of firearms and medications play in veteran lives and is consistent with their values and priorities. And that's what we have found. And so most suicidal crises are brief. The time from decision to action is usually less than 1 hour. And here we have some studies. Less than 5 minutes, 24%. Less than 20 minutes, 48%. And within an hour, 71%. Okay? And this is why we have to build in time and space between the thought and the action. And lethal means safety, it does work. And reducing access to lethal suicide methods is one of the few population level interventions that has shown to decrease suicide rates. And about 90% of people who survive a suicide attempt do not necessarily go on to die by suicide, which is great. And so this is why we collaborate ahead of time with the veterans and their providers and their family members. And when we do that, we have likely prevented suicide for the rest of their lives. Now, suicide is preventable. Now, get ready, guys. I'm going to ask some questions, and I want you to drop your answers in the Q&A box. Okay, here we go. First one. We're going to talk about some common myths and realities. And so people who talk about suicide are just seeking attention. Is that a myth or reality? I want you to drop it in the Q&A box. People who talk about suicide are just seeking attention. Myth or reality? So far, I see one myth. I see reality. I see more myths. Okay. So, it's a myth. So no matter how casually or jokingly said, suicide threats should never be ignored. And they may indicate serious suicidal feelings. So someone who talks about suicide provides you with an opportunity to intervene before those behaviors occur. Now, just because someone has a thought, it doesn't necessarily mean that they have a plan or intention. But clearly, if they're having these thoughts and they're talking about it, that means that they need some assistance. And that's your opportunity to intervene and provide that assistance. Okay, next question. Myth or reality? The only one who can really help someone who is suicidal is a mental health counselor or therapist. Is that a myth or reality? The only one who can really help someone who's suicidal is a mental health therapist or counselor. Okay, I think everybody got that one correct. That's a myth, because special training is not required to safely raise the subject of suicide. So helping someone feel included and showing genuine heartfelt support can also make a big difference during a challenging time. And I will tell you, if you're a good listener and you validate that individual, you have gone a long way. Many times people don't get an opportunity to express themselves. And so just by being a good listener and allowing that person to vent, you have gone a long way. Now we're going to cover the steps of S.A.V.E. And so, as I said earlier, this is the VA's one-on-one gatekeeper training. It's an entry-level suicide prevention training. It's teaching communities how to help veterans or anyone at risk of suicide It's going to help you act with care and compassion if you encounter someone in a suicidal crisis. S, signs of suicidal thinking should be recognized. A, ask the most important question of all. So let me ask you guys this. What is that most important question of all that you should be asking if someone is in a suicidal crisis? What is the most important question of all? You can drop that in the Q&A box. And then I'm going to get back to that when we get to A. V, validate that person's experience. When you validate someone, you make them believe or know that their opinion matters. You make them feel that they matter. And so when you validate someone, you have definitely gone a long way, a long way. E, encourage treatment and expedite getting help. So let's start with S, signs of suicidal thinking. So learn how to recognize these warning signs. And these are warning signs of suicide, hopelessness. We have seen a lot of that, especially in our veteran population, hopelessness, feeling like there's no way out of their situation. Anxiety. This is that feeling of nervousness, not knowing what, when, or who, walking on eggshells. Some people will have physical symptoms. Some people will feel nauseated, sweaty palms. Some people feel claustrophobic. Some people will actually go into a full-blown panic attack. Okay? Agitation, sleeplessness, or mood swings. Feeling like there's no reason to live. Rage or anger. And one of the things we know about rage and anger, generally, when we peel back those layers of rage and anger, we can really find some mental health issues underneath, whether it's depression or anxiety, okay? Engaging in risky activities without thinking. I have seen many of these things. People riding on motorcycles, high rates of speed, no helmet, weaving in and out of traffic, okay? It's like a no-care attitude anymore. Increasing alcohol or drug use. And remember what I said about alcohol and drugs, mood-altering substance. It alters your judgment, okay? Withdrawing from family and friends. That's another warning sign of suicide. And the presence of any of the following signs require immediate attention. Thinking about hurting or killing oneself. Looking for ways to die. And believe me, there's 1,000,001 things that you can do to the 10th power, okay? Talking about death, dying, or suicide. Self-destructive or risk-taking behaviors, especially when it involves alcohol, drugs, or weapons. A, ask the question. Know how to ask the most important question of all. So let me see. I see someone says, do you have a plan? Why do you feel there's no solution? Are you thinking about taking your life or hurting yourself? Those are all some great answers. But this is the question that you want to ask. Are you thinking about killing yourself? You want to ask this question and you want to ask it that way. And the reason we want to ask this question this way is because we don't want to make any mistake about what we're trying to ask this individual. See, because if I say, are you thinking about hurting yourself? Well, hurt can mean a lot of different things for a lot of people, you know? But if I say kill, it has only one meaning. And this way, that person will give you a yes or no answer versus, well, I could be hurting myself. I could stub my toe and hurt myself. Hurt means a lot of different things for different people. So you want to ask this question, you want to ask it in this way. Are you thinking about killing yourself? Okay. Now, when you do ask this question, you want to ask the question and you want to make sure that you do some of the following. You want to ask it if you've identified those warning signs or symptoms. And remember, just because someone has a thought doesn't necessarily mean that they have a plan or intent, but when you ask these questions, then you can get them help, okay? Do ask the question in a natural way that it flows in the conversation. If you're talking to someone and they're telling you, I'm going through all these things, I'm overwhelmed, I feel like I could just walk in front of a bus, they may not actually have a plan or intent to walk in front of that bus, but clearly they're sharing with you that they're overwhelmed and that they're dealing with a lot of issues and these thoughts are crossing their mind, okay? And you want to be able to assist them. Don't ask the question as if you're looking for a no answer. So if you're looking for a no answer, all you have to do is put no in the question. You aren't thinking of killing yourself. And if I say you aren't thinking of killing yourself, I'm already answering the question for the individual. You have to leave the question open-ended so that that individual can answer as honestly as they can. Okay? If I tell you you're not going to kill yourself, then I've answered the question. Don't wait to ask the question when someone is halfway out the door. You want to make sure that you use every available opportunity to assist that individual. Okay? So ask it early enough, especially if you've identified those warning signs. V, validate that person's experience. I cannot emphasize anymore how important it is to validate people. So when you validate someone, as I said previously, you make them feel like their opinion matters. They matter. You're willing to listen to them. You don't have to agree, but just by the mere fact that you're listening and allowing that person to have a voice, it will go a long way. It will make a huge difference. And many times when people are in a crisis, they know that there's nothing singularly that you can do. However, if you can just be a good listener and validate them, you've gone a long way. You've gone a long way. So talk openly about suicide. Be willing to listen and allow that person to express their feelings. Recognize that that situation is serious, because it is. Don't pass judgment. One of the things we know about human nature is that we can easily tell when we're being judged. And so if you're judging, it's going to be a turnoff. So don't pass judgment. People have done all kinds of things in their lives. They're not proud of it. But if they're coming to you as broken and they're sharing, don't pass judgment. Reassure them that help is available, because help is available. Okay. Next, encourage treatment and expedite getting help. So what should you do if you think someone is suicidal? You don't want to keep it a secret. This is not the type of secret that we keep. Don't leave that person alone. One of the things that we know about this career field is that, when someone is alone, we think that there's nothing available, nothing in the room. People find things. They have used all kinds of things. So don't leave that person alone. Okay. Try to get that person to seek immediate help from his or her own doctor, the nearest hospital, or emergency room. And I would say even go a step further and escort that person to the emergency room. Okay. Call 911, reassure them that help is available. And if it's a service member, then you can call the Veterans Crisis Line. And actually, the Veterans Crisis Line and the National Suicide Prevention Lifeline, it's the same number. So just dial 988. The only difference is if you press number 1, that's going to be a veteran responder. If you hold the line, it's going to be a civilian responder. But it's the same number. The Veterans Crisis Line and the National Suicide Prevention Lifeline. Okay? It's the same number. So when talking with someone at risk for suicide, first thing you want to do is remain calm. You don't want to get all riled up and excited, because it's not going to help the situation. Listen more than you speak. Remember, let that person vent. Validate them. Let them speak. Maintain good eye contact. Act with confidence. You may not know everything to do, but you can certainly act with confidence. Don't argue with that individual. There's so many controversial topics out there. Everybody has their heels dug in. It's a no-win situation. Politics, abortion, religion, just stay away from those topics. It's a no-win situation. Use open body language. Don't be like Macaulay Culkin on Home Alone with the shock face. Use open body language. Limit your questions. Let that individual do the talking. Use supportive and encouraging comments, but be honest and let them know that there's no quick solution, but help is available. We have had people call Veterans Affairs and say, they're 8 months behind on their mortgage, they're going to kill themselves. The reality is the VA does not have petty cash where they can just write a check for 8 months of a past mortgage. And I would even go further to say, if you're 8 months behind on your mortgage, it's going to take at least 8 months to clean it up. There are resources available, housing resources and things like that, but the VA does not have a petty cash to pay 8 months of a mortgage. So what do you do if you're talking to someone and they express suicidal ideation on a phone call? You want to keep that caller on the line. Don't hang up or transfer. One of the things I can tell you about transferring calls is that when I worked in an office full time, I was never really good at transferring calls. I just didn't transfer enough during the year. Our call center operators, they're the most trained people to transfer calls. So don't transfer or hang up. Remain calm. Get as much identifying information on that caller as possible, their name, their phone number, their current location, even if they're using a nickname. Even if they're using a nickname, just get as much information as possible. Now, if you can conference call to the Veterans Crisis Line if you know how to conference call. If you don't know how to conference call, then don't do it. But you can conference call to the Veterans Crisis Line. The responder on the other end can pick up and they can take over the call with the individual. Okay, but you really have to be skilled and do that enough to know how to do it. Also, enlist your coworkers for assistance. Use instant messaging, use your cell phone, whatever you need to do to enlist help from someone else. We're fortunate in the government and other agencies where we have Microsoft Teams and you can message people, while you're on the phone. And they don't have to even be in the same city you're in. As long as their light is on and they answer, you could say, hey, I need some help. I got this person on the line. They're located here. And they can seek help for you. Okay. If the caller disconnects, call them back immediately. Okay. If no answer, then you want to go ahead and call 911 and let them know that you were on the line with a caller and you somehow got disconnected, and if they can go out and do a welfare check. And after that's done, then you can go ahead and call the Veterans Crisis Line, dial 988 and press number 1. Okay. And then you can practice conferencing call with your friends or colleagues at your desk, and that will help you get better with conferencing calls. And so there you have we went over the signs of suicidal thinking. They should be recognized. Ask the most important question of all, and that question is, are you thinking about killing yourself? Validate that person's experience. Let them know that they matter. Encourage treatment and expedite getting help. So those are the steps of S.A.V.E. that we have just gone over. Now I'm going to go over quickly some resources, and then we'll have a few moments for Q&A. So this is the Veterans Crisis Line. It operates 24 hours a day, 7 days a week, 365 days a year. The number changed last year from the 10-digit number to 988, which has made it more convenient for people in crisis to seek help. So all they would have to do is dial 988, and that's for the National Suicide Prevention Lifeline or the Veterans Crisis Line. If you're dialing for Veterans Crisis Line, then you would just press number 1. Anybody can call this line, veterans, family members, service members, friends. You can even call anonymously. Okay. The Veterans Crisis Line was stood up in 2007, and it has been going strong since. We have taken more than 6.8 million calls. We're probably over 7 million because this data was for March. So we probably are well over 7 million calls by now. More than 800,000 chats, more than 299,000 texts, and over 1.3 million referrals, and over 269,000 dispatches of emergency services. And when we talk about dispatch of emergency services, we're talking about going out to the location where the individual is. Next, our local suicide prevention coordinators. We have at least 400, maybe a few more. We have one at each VA medical facility, and they have a team that works with them, and we may even have more than one at some of the bigger locations. But they are the people who receive the consults from the Veterans Crisis Line. So if someone calls in and says, they're having these thoughts of suicide, they have no plan nor intent of harming themselves, but they can make a safety plan and they're willing to come to the VA, our suicide prevention coordinator would then get a consult on that individual, and then they have 24 hours to contact that individual. And if it's an emergency situation, then they'll dispatch emergency services right away. And our suicide prevention coordinators, they do direct care, they do monitoring and oversight, they do outreach and education, and they do report and tracking. And then we have a veteranscrisisline.net resource locator. So this locator, if you put in your city and state, you can find the nearest VA medical center, you can find the vet center, and the suicide prevention coordinators. And we also have the community-based outpatient clinics. So all of the VA resources are listed on this locator, the medical resources. Making the connection. So this is some of our vignettes of veterans who receive care through the VA, and they talk about their stories of their struggles and how mental health has changed their life by getting help. And so these are real veterans giving some real life feedback on their care. Next, practice safe storage of firearms, medication, and other lethal means. So keepitsecure.net. And so this website will tell you about lethal means safety and securing unloaded and locked up weapons. And then we also have partnered with the National Sports and Shooting Foundation. They have posted our emergency Veterans Crisis Line numbers, especially at their events. And so partnering with them has been very positive. We also have had some ads with the Ad Council. You may have seen during some of the bigger sporting events like NASCAR races and NFL, they'll talk about safe storage of guns and other lethal means. The new lethal means safety resources. This is some of the training that has come out for not only veterans, but providers and their families. Some of the safety risks and how to secure those weapons and some of the things that you need, such as cable locks and lock boxes and tool medication boxes that lock and things like that. Next, we have our mental health mobile apps, and these are free apps that you can download. Our only thing that we say about these apps is that you can use them, but we recommend that you use them in conjunction with your therapist. They're not made to just be used on their own to cure whatever issue you're dealing with, but it's to enhance treatment. Next, our safety plan is in our PTSD coach app. And so a safety plan is a written list of coping mechanisms that people can use when in a crisis. And so now we have it electronic, and it can be placed on your phone, and you can just go ahead and pull them up as needed when you're in a crisis. So that's a good tool. Coaching in the care. So this is another resource for family members. If you have a service member who's reluctant to get care, you can actually call Coaching in the Care, and they'll give some good tips on how to get that person to seek help, or they'll even speak to them directly. Now we have resources for LGBTQ+, and so we find that we have to continue to support our LGBT community. Postvention resources. We don't talk about postvention a lot, but we should, because we have had tragedies in our community, and so our providers have to be ready. We have to be ready in the workplace, and so these are resources that are available for postvention. And then our VA SAVE training, which is on Psych Armor Institute. We partner with them, and they have a website, psycharmor.org, and they have the same VA SAVE training for free. It's about 25 minutes, and we just encourage people to go on that website. Only thing you have to do is register. There's no cost, and they have some other trainings on there as well, like military culture. So it's some good training on there that communities can use, and it's all free. And that's it for my presentation. And so, Ms. Pauling, I'm going to turn it back over to you for any questions that one may have.
Thank you so much, Ms. Mells, for that very informative presentation. Now we're going to address any questions in the Q&A box. I will read the questions out loud, and Ms. Mells will provide a response. If we're unable to get around to all of the questions today, we will, we have your email address, we have your question, we'll get a response back to you. First question is coming from Pastor Mimi C. Robinson. And our question is, should we stay on the line even after the counselor is on the line so that we can still show support and so that they will feel they are supported and not alone?
Yeah, I think that
So
that would be up to the individual. If you let them know that you're passing them along to the crisis line, and that respondent can take over. If you feel that your relationship is such with that individual that you want to provide support, I don't see any reason why you can't.
thank you so much. Next question is from Jerome Matteo. Do you know of agencies or law enforcement, such as sheriffs or something of that nature, to that can safely store weapons short term?
Not offhand, I don't know, but I would say the community that you're in, you could actually inquire at the law enforcement. Um, some have armories, but you would have to inquire because each state and city is different.
Thank you so much, Jerome and Pastor Robinson, for those questions. Those are all the questions that I see right now. If you have additional questions, just send Ms. Mells or send it to our team. Here's our point of contact information here, and we'll get the question to her, and she'll provide you a response directly. We do have your email address, so we do know how to reach you. If you would like to reach out to any of our team members, as I mentioned before, here's our point of contact information, our email addresses, our website, our CFBNP email address, as well as our Facebook page. At this
And Ms.
time,
Pauling, I'm sorry, Ms. Pauling, I think I saw one question earlier. Someone was asking about a recording. All the recordings are on the CFBNP website, so they can take a look at the website for that.
okay, thank you so much, Ms. Ms. Mells. If you register for this event, we will provide you with today's handout of resources. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website for future webinars and to our Facebook page for information. This adjourns today's webinar. Thank you so much again, Mrs. Mel, for today's presentation. We are eternally grateful to you. And thank you for joining us today, and have a good day. Thank you and
Always a
goodbye.
pleasure. Thank you.
Thank you.